Welcome, everyone. I'm Denny Brennan. I'm the Executive Director of the Massachusetts Health Data Consortium, and I want to welcome you to today's webinar, What It Looks Like to Be Done with Healthcare Price Transparency. We are looking to have a back and forth, vibrant discussion today of what healthcare price transparency is, how we get there, but most importantly, what it looks like to be done. We're going to be discussing ways in which the road to healthcare transparency is traversed, but the journey is far from over. We know that there are government mandates that are accelerating the move to price transparency, and we know that people see price transparency as a critical part of the consumerization, for lack of a better word, of healthcare going forward. We want to make informed decisions based on price, based on quality, based on accessibility, based on equity. And we can't do that if we don't know the prices that are going to be exacted from us for the services that we require. Consumers need to have trust in this new health data economy, and pricing is a critical element of that. Key points that we want to discuss with you today include the following. One is how to use data and guidance to deliver a more helpful user experience. Secondly, how to deliver information as transparently as possible. And third, what the future might look like for price transparency, and to identify points and paths forward and partners that can drive success. Now, briefly, let's go over a few details about today's webinar. We anticipate this webinar to be 90 minutes in duration, with approximately 60 minutes of those devoted to discussion by our guests from HealthSparq. We also envision approximately 20 to 25 minutes for questions and answers. We encourage you to post your questions in the Q&A panel during the course of the presentation, and we will ask those of our speakers. And at the end of the presentation, we will take your raised hands if you would like to ask us questions directly, in addition to your providing questions in the Q&A panel. If we can't answer your questions today, we will do our best to follow up and answer those either on our website or in direct correspondence with you. Over the course of today's presentation, we will be launching 2 polling questions, and we would really hope to hear from you and get your perspectives on this interactive part of our discussion as we go forward. So without further ado, it is my pleasure to introduce today's speakers. And I want to say first and foremost that my introduction to the work of HealthSparq was enabled by our partner, member, colleague, the Healthcare Executive Group, and Ferris Taylor. So I want to thank Ferris and the HCEG team for introducing me to HealthSparq and introducing MHDC to the kinds of things that HealthSparq is doing that can enable us to understand better what transparency looks like. Joining us today is Matt Parker, who is the Senior Vice President of Product for HealthSparq. Matt is an industry leader with more than 20 years experience working in technology products and bringing solutions to the healthcare marketplace. Also, we are joined today by his colleague, Keith LoMurray, who is a Vice President of Platform and Data at HealthSparq, and who will be bringing to us his perspective on a number of aspects of the healthcare price transparency journey. So allow me to welcome Matt. Matt, it's a pleasure to have you join us.
Denny, it's nice to be here today. Thank you for having us.
And Keith, it's a pleasure to have you joining us. Thank you for speaking with us today.
Thanks, Denny. It's a pleasure to be here.
Okay, so we have a lot to cover, and I've talked too much already, so I'm going to turn over our discussion to you. during the course of which I will probably be asking, stepping in periodically to ask questions as they come across the transom. So gentlemen, I will turn this over to you.
Great, thank you so much. Like I said, it's really good for us to be here. Today, we're going to spend a little bit of time just going over who HealthSparq is, so you understand, for those on the call, who we are. And we're going to talk just a level set on the sort of the state of the mandates. And then we're going to talk about how we see the work of those mandates leading into sort of what we consider our mission around guiding folks to care, right? So our overall objective as an organization is to really help people access care wherever and whenever they start. So a little over a year ago, we came together with a company called Kyruus. We today serve health systems and health plans, help folks. So health systems call them patients, health plans call them members, we call them people. We don't like the consumer word, but we call them people. Our goal is to help people find care when and where they need it, to make sure it's the right care for them, for their particular needs, for their particular personal situation, and that all of the things that you need to do within that sort of decision-making framework is available for you while you're making that decision. So, on the payer side, we support that with care search, with price transparency, with personalized guidance. On the health system side, again, care search. Who in a particular context is doing the thing that I need at this time? Or if you don't know what that you need, how can we help you find what that is? Understanding who's available to see you and actually booking those appointments, right? So our goal really is to connect all of the places where people look for care with all of the ways in which care can be delivered within the system. And so that's sort of the mission and vision of how HealthSparq and Kyruus come together to serve people as they are engaging with the healthcare system. Today we do that across 95 health systems, hundreds of health plans across the country. So I think under management, we have a little over 300,000 providers that we work with directly through their health systems, hospitals, medical groups, et cetera. We book millions of appointments a year through our applications on the system side. And we've been doing transparency and healthcare guidance for payers for 10 plus. We're almost at the 12-year mark, so I'm very excited. In about a year, I'll be able to say for a dozen years. We're very close, but we've been working on kind of solving these problems for a long time, and we have a footprint for both payers and plans nationwide today. 90 million Americans have access to our care guidance and transparency solutions nationwide. And how do we do that? So we do that with a platform on the payer side. We do that with a platform we call HealthSparq One. It is primarily focused on delivering personalized guidance around what your options are available as a member of that health plan, who treats what you're looking for, how are they covered under the plan, what are the costs of care, any quality or reviews related item, and it does integrate with our Kyruus. Health system, so the ability to book directly with providers who offer that ability can be surfaced in that directory. So we really are trying to close the loop of, I need care, here is some guidance on what that care looks like and how to book that care directly with that provider. So from a person standpoint, from a consumer or an end user standpoint, they can run through that sort of full gamut of an experience within that application. And we do that through a hosted web experience and a mobile experience. We also support all of our sort of native technologies API first. So many of our payer partners are able to build experiences on top of or in addition to our hosted experience, so that they can, if you go back to that earlier hourglass slide, thinking about access points, not everybody goes through the same link. So we have a very strong there's no wrong door policy into how people start their process of looking for care. And so we work really hard to enable that, to help people find what they're looking for when and where they start that question. We do support machine readable files. It's a necessary part both for transparency as well as other regulatory and compliance-based concerns. And we do support legacy means of communicating this information, like print-ready directories, as well as part of our applications. And all of this platform is done under the rubric of understanding and supporting a payer's compliance needs. So when we get into a second, and I hand it over to Keith, and he's going to talk a lot about where we are specifically around the transparency and coverage and no surprise work. Our focus is, and you'll hear us talk about this a little bit at the end, we're doing all of this work to help a payer's members find and get care when and where they need that. But we fully understand that that has to be done within a compliance guideline that has both state and federal rules that need to be applied, as well as industry rules, NCQA, and other regulatory bodies. And so part of what our service offering is really around focusing on how to create a really compelling, usable, and effective member experience that allows members of health plans or patients of health systems, people in general, it allows them to act on information that they need to make those decisions, and doing that in a context where we know you have to meet regulatory rules. And so we're balancing those compliance guidelines and what is a useful and compelling experience. We titled this presentation, "What It Means to Be Done with Transparency." For all of you on the payer side who have spent the last few months scrambling to get your MRFs out the door, we don't mean that in I'm done with transparency. We mean that, of course, what does it mean for transparency to be a completed objective, a completed goal that we're doing? And I'm going to spoiler alert for the end. It will not be done. This is a problem that we will continue to be working towards for a long time, because again, the goal of this is not to just put price information out there or cost information out there. This data is a tool, and it's a tool to help members find care when and where they need it, to understand their benefits, and to be able to make decisions about their care that are fully informed, so that they're more satisfied with you as a payer. They have a more informed choice around which provider that they're looking for. They don't have surprises around budget and cost, et cetera. So this, again, transparency for us is a tool to help folks make better choices, and not an end in and of itself. So with that, I'm gonna, did I lose my navigation there? I would like I'm gonna mute and hand it over to Keith to talk specifically about what and how we're working within that regulatory framework, specifically around transparency mandates.
Okay, thank you, Matt. And so I'm going to talk about the mandates, and I don't think it will come as any surprise to people to know that we are living in a world at the moment that has a lot of regulatory kind of opinions about transparency in general, both in the health system as well as in the health plan space. I think both at the federal level as well as at the state level, what we are seeing is transparency is one of the main tools being leveraged at the moment for kind of changing the, for lack of a better word, the cost curve on healthcare. And so that's a big approach happening. And there's lots of moving pieces with transparency and coverage, with No Surprises Act, and with some of the hospital mandates as well. So I'm going to walk through kind of some of the, especially on the federal level, what is going on, and then some considerations that we need to take into account given what we know both about the mandates as well as about kind of some of the, what I always refer to as the rough edges of the mandates, the things that you need to be considered to make sure that we're making this an experience that a person can really use and find effective. So jumping in to the first thing I'll talk about is on the hospital side. We have had the mandate in place since 2021 for some of the price transparency information. And there's two elements of this. There is a machine readable file requirement. So when we refer to MRFs, machine readable files, they are basically just a file that a computer knows how to read. And for the hospital side, I would say for those of you coming from the health plan side, where we have some very, very specific requirements, specific schemas dictated by CMS, the hospital side is a little bit more freewheeling in what they're allowed to do on the machine readable files, but you are required to be posting machine readable files, and there are some specific elements that do need to be included in there. And then you also need to be powering a self-service tool with the 300 standard kind of shoppable services and make those available to the member, to people on their site. And with this one went into effect in 2021, but there was not a lot of enforcement around that. We are seeing changes in the enforcement side on the hospital. So recently, there have been penalties and fines associated with those who are out of compliance. So this is an area where, even though the actual mandate has been in place for a little bit of time, we are seeing more and more attention being paid to compliance with this. And also, I think because of how the hospital price transparency was rolled out, both from a lack of a schema, a lack of kind of standardization, as well as kind of a lack of initial enforcement, I think the departments have taken a more specific and targeted approach when it comes to the health plan space to really make sure that kind of what they're doing is going to have some meat on it, for lack of a better term. So going into kind of what we're seeing on the health plan side, this one we have a couple phases of work. So we have two main mandates that we're tracking for the health plans. We have the transparency and coverage mandate that was released. I forget, I should know this, but I forget the exact date. I believe it was somewhere very late in 2020 where that final legislation was set into effect. And that had 3 phases of work. So the first phase was around these machine readable files where you need to post both the negotiated rates for all items and services, as well as you needed to post the out-of-network allowed amount for any provider who met a 20 volume threshold. And so there's some specific rules in there about kind of what needed to be posted. CMS has a repository for kind of the schema for all of the requirements for how to be doing this. And with the machine readable files, there had been in the initial rule one for prescription drugs as well. In subsequent guidance, CMS did defer the prescription drug just because there was some conflicting information and conflicting regulations about other reporting requirements for prescription drugs. So that one is currently on hold and pending further rulemaking. So we'll have to see where the departments go with the prescription drug reporting. But for the other two, for the negotiated rates and for the allowed amount files, those did go into effect on 7/1. If you work for a payer and you're interested in compliance, that is something that you probably were heavily involved in the kind of lead up to this. It was all kind of brand new information for everyone. These are not things that were just like sitting in a database for most people and they just need to extract it. They ended up needing to go out and find new kind of novel ways to get access to this information. So it's been kind of a major sea change in the health plan space to be able to even pull out the negotiated rates and put them into these sorted files. So that went into effect on 7/1. The next phase goes into effect on January 1, 2023. So this is, I'm sure, where people are turning their attention now. And this is where we have a self-service tool that a member can be able to use, and they can access basically price transparency information for 500 items and services. And in this one, we have some additional requirements from the departments in transparency and coverage, where I believe that there are 7 kind of core elements that must be included in the self-service tool. So that includes things like you must display the negotiated rate, you have to have the member cost share liability, and there's a variety of other pieces of information that are required in order for you to be in compliance with the transparency and coverage legislation. And you need to be able to have the member access this via either phone, be able to get basically a paper-based form mailed to them if they call into your call center, or they can get it via the self-service tool. And In this one, there was also, in the No Surprises Act legislation, there was also a need for price transparency tool, and the departments have indicated that they are going to align the transparency and coverage and the no surprises requirements around price transparency. And so they are working on that rulemaking, but we do think that it's going to align very closely to what we have with transparency and coverage, with some minor changes to address some of the No Surprises Act stuff. And then the next phase is around January 1st, 2024, where you take that self-service tool that has 500 items and services, and you now need to support all items and services that are basically covered by that health plan. And so it's really scaling out from maybe 500 to 25,000 or more billing codes that need to be considered and need to be supported, and kind of how do you navigate a member through will be something that is very important consideration. So those are the big main enforcement elements that are kind of coming up on the horizon. And then the other item is a new element from the No Surprises Act called an advanced EOB. And the advanced EOB is one where the concept here is really that a member or patient, they can go basically to their provider, and during that flow, they can get what they're calling an advanced EOB. That would be a notification of, hey, here's the services we're going to perform for you, and here's how much those are going to cost. And this is really a collaboration between the provider and the payer, where the provider is going to be the one saying, this is what I plan to perform, and then the payer needs to price that out, generate the document, and supply that document to the member. And so this was one where it was originally going to go into effect on January 1st, 2022. The enforcement for that one has been deferred. The reasoning behind that is, in order for the provider and the payer to really collaborate on this, there does need to be some sort of standard. Otherwise, it will just kind of be the Wild West where everyone's making things up and on the phone all the time. And so the departments deemed that it was not currently feasible to comply with the advanced EOB without some further rulemaking that clarified the requirements. So the assumption is that currently the CMS and others are working on those rulemakings. We do expect them to go through a full rulemaking cycle here. And so we would expect some sort of draft rules and then the final rules for what advanced EOB looks like. If I could just give a little bit of commentary of kind of the things that we could expect there. I do think that the likelihood is that they come out with some sort of interoperability standard, say like a FHIR standard, for how providers and payers can pass information back and forth. So I think that's the likely piece, and there's potential where this needs to go through some sort of pre-adjudication or mock adjudication flow, rather than leveraging the same pricing technologies that you would have in a self-service tool. We are going to have to see exactly where that goes, of whether they align it more towards transparency and coverage, where kind of similar pricing, or whether you're really talking about kind of true adjudication sort of methodologies, where we're getting down into a claim line level pricing that is really more applicable to what a provider would know than what a member would know. So there's going to be some unknowns there, and we're going to have to kind of see how the rulemaking shakes out for exactly how this one will end up being defined.
Keith, we have a question here that I think is relevant to this conversation, which is, when we get to the no surprises aspects of this and the advanced explanation of benefits, do you see those superseding the need for hospital and payer price transparency requirements that we have to do first? Right now, 21 to 24 is the hospital, tell me how much these services cost, health plan, tell me how much these services cost. But when the advanced EOB comes around and I'm sitting with my physician who says, here's what it's going to look like, this is what we'll send you that will give you an explanation of the costs, the prices that you're likely to pay, your copay, what have you. Do you see, when we reach that point of the advanced EOB, that standing up payer and provider price transparency tools will be as relevant as it is in the near term?
Yeah, I would say I think that they're still going to have a very important place. And I think the analogy I would use is, like, let's say you're shopping for a contractor for your house, where you may want to do some research on your own, and that would really be where the self-service tools come in, where you don't know exactly what you're getting, but you're trying to prepare. You know, hey, I know I need knee surgery. I need to know roughly how expensive that knee surgery is going to be, and I perform a bunch of research before engaging in kind of my specific provider. I'm helping myself find who is the right person to perform this care, where should I be going? And then the next phase would be where that advanced EOB comes, is you're like, I know who I'm going to be receiving this with. I'm now working with that provider, and kind of to use my analogy of like the contractor for, let's say I'm getting a deck, is now where I'm getting the specific bid for the specific services that I'm going to be having. And so it's kind of more of a little bit broader general research into the much more targeted information. And I think both of those are kind of critical elements of that experience that we have in engaging with healthcare. Both of those are very important, and they have different information that's needed. So as a self-service tool, you need to have things much more easy for the member, is much less kind of clinical, technical things that you wouldn't know. And then once it comes to the provider and their practice office, they will have much more detailed information about, like, here's the specific MRI I'm going to perform, here's the specific billing codes I'm going to submit, and that can give you a much more detailed and kind of exacting quote.
Thank you. I have one other question before we continue. Can you talk to the usefulness of the price transparency efforts to support comparison shopping? You know, this is an element that's a big aspect of what it means to be to open things up for a consumer. Could you talk a little bit about that? Are the data going to be sufficient to enable that? Are there going to be, in your mind, tools that will allow people to do comparison shopping, or is this going to be a one and done type of arrangement?
So we'll cover that a little bit, Denny, in the section after the first polling question. And I think just as a preview, you know, our view is to Keith, to the deck analogy, right? So when you're shopping for contractors, you're getting estimates, and once you've picked a contractor, you're getting a quote, right? That's not a 100% parallel way of thinking about it, but it does help sort of frame it in a non-healthcare related way. So what the comparison tool does, and the self-service shopping tool does, is allow you to look at a reasonably accurate estimate of price for a broad number of providers or facilities that are going to do a thing for you in healthcare. That will continue to be needed. That relies on a lot of data to create the sort of the spectrum of accuracy. So how accurate can that get? So the data that we are generating for transparency and coverage with the machine readable files are a part of that. It's not the end of the data that's needed, but it is a part of it. Billing practices, modifiers, there's a whole bunch of stuff that goes into having a reasonable estimate. We'll talk a little bit about that in a slide or two. We're going to talk about how we see that fitting into that overall guidance story of helping people find and get care when they need it, and how cost and all of the information that's needed. And frankly, transparency and coverage actually helps, right? So historically, transparency providers have focused on using claims and historical experience to get to some of those estimates. Those claims-based approaches are still really important, because claims shows things like billing practices, right? So which specific codes does a specific provider or facility submit on average, or typically when they're doing this type of procedure, and you're talking about a number of CPT codes, right? Like there's a lot of variation that can appear there. But what claims doesn't do is help you for providers in a network that doesn't have sufficient billing practice or hasn't done something far enough, right? So that's not enough. And so all of these little pieces actually fit together to allow us to do that from a comparison standpoint.
Thank you very much.
Okay, so the next thing I want to touch on is I mentioned previously that when it comes to just kind of, if you read the mandates, what you need to do, I will describe it as there's some very sharp edges to that, where if we just design a tool that meets the letter of the law, there's going to be a lot of challenges for a member. And I want to talk about a few of those. So one of them, for those of you who have been involved with these machine readable files, they're a novel thing, this new information, but they have a lot of kind of challenges with them. Some of those are just like they only have NPI and TINs. So if you are bringing that into a self-service tool, you really need to be bringing a lot of other information about the providers to really make it a true shopping experience, to make it known kind of who the provider is, provide context about these things. The other piece of consideration is these machine readable files where we would be sourcing this negotiated rate from. It does not, it basically is just kind of, for the typical health plan, they're taking kind of a mapping of here's all the providers in our network and here's the fee schedule for everyone. And they do a full mapping of that. So you'll end up with the behavioral health specialist listing that they have an ACL repair. And so really, to make it useful for the user experience, we need to be bringing additional insights in, limiting it down to relevant providers only, and not have the kind of irrelevant providers are just kind of making the tool unusable. So that is one kind of core consideration, is the machine readable data on its own. If you're just bringing that in and assuming that you can basically perform a search and build a UI on top of that, that's really not going to be enough. There needs to be some layered logic. There needs to be additional information that needs to be brought in just to make the core machine readable data useful. The other big consideration is one of the core elements of transparency and coverage for the self-service tool is around, you need to have that member estimated cost sharing liability. So how much is the service going to cost for the member based on their benefits and where they are in that benefit? And traditionally, a lot of plans have leveraged the 270X EDI framework. And so this is a 270-271 transaction. That is kind of, it's a transaction that can be used, but it really has a lot of limitations, especially as it comes to plans with more complex benefit designs. It just was not built for that use case. And so there are other ways to solve this problem that are more scalable to the actual use case that we have to meet this needs. But if you are going to be using a 270X framework, it's important to understand the limitations of 270X, especially when it comes to complex benefit designs where it may not identify basically different benefit differentials by the service code of different provider types. And so lots to consider there if you're leveraging that. Another area to consider is around, we now have the concept of modifiers and revenue codes. Those were kind of, especially the modifiers, were a late introduction into the machine readable files by CMS. And so making sure that we're taking into account, how do we use modifiers? What would it mean for a member when you have the price for a modifier 26, which is the professional component, or modifier TC for the technical component? Like the member doesn't know what to do with that. Like most people in the world don't know what to do with that. So really, to make it a useful experience, you need to be going beyond just displaying kind of straight, here's what the modifier price is, and giving them the context of what that entire cost is going to be. So another important consideration is modifiers. And then we have another kind of element, which is within the legislation, there's kind of some very specific scenarios described by CMS. One of them is related to when you have a fee schedule and you have a negotiated rate. You need to be displaying both of those situations. So it's a very specific requirement. It's one where we have not actually found anyone who has that scenario. And so it might be one of those things that CMS was kind of overthinking kind of how some of this worked. And we see that in a couple other places around like bundle payment arrangements and other things like that. But this is an area to pay attention to. Make sure if it is applicable to you as a health plan, kind of make sure that you have a plan to support that. And I mentioned the next one previously of kind of the way the machine readable files are structured is really this kind of like, it gives you the information about everything. It gives you information about every place of service code, every provider, whether they're relevant or not. So even though I might be a ambulatory surgical center, I might have a cost for what I would charge as an in-network hospital. And so lots and lots of things to consider about making sure that we are identifying only the relevant information, and that the member isn't having to sort through that to somehow anticipate what is going on here. So lots to consider just as you're bringing the machine-readable data in. And then the last thing I want to call out, there's many other examples of kind of how we go, like how you would need to go above and beyond. But one of the other changes that CMS made to the machine-readable files is they allowed for the fact that there's these percentage of charge arrangements where you basically say, I will pay 70% of the billed charge for this provider, and you don't know what that billed charge is. And so as a result, CMS said, we aren't going to require you to know that. Instead, what we're going to do is you can just say it's 70% and it's a percentage charge contract in the machine-readable file. However, they did not change anything about the self-service tool requirement that says you must display the dollar amount for what something is going to charge. And so there is a need for further guidance from CMS to say, do we need to basically take what we were doing for machine-readable files, which was calculating a dollar amount, and did you basically just push that burden onto the self-service tool? Or are you saying we should display the percentage and somehow inform the member about, like, you're going to need to know the bill charge, and if so, do we want to kind of give them some estimates based on history? So there is a need for more information here about what is actually compliant with this, and then given the different scenarios, kind of how exactly we want to solve this problem. So another area to consider as we move into supporting the self-service tool. So I think in conclusion, there's a lot to be done with the self-service tool as we approach 1.1.23. Lots of considerations kind of as you're thinking about your solution, and something that HealthSparq's been thinking about and putting the groundwork in place for this for quite some time, but wanted to call out some of those considerations in this kind of very kind of detailed level of what we need to be considering here. So Denny, I'll pass it back over to you now to lead us to our first poll question.
Thank you, Keith, and thank you, Matt. Our first poll question will be coming up on your screen momentarily. And that poll question is as follows. What is your organization's approach to the transparency mandates? You can select one or more of the following. Working to meet the mandate. You are using the mandate to reach broader digital engagement goals. Your approach to the mandate is designed around maximizing the consumer engagement, or you're not sure. So again, we have this poll in progress. Please take a moment to address this question. What is your organization's approach to transparency mandates? You can pick one or a number of these. Working to meet the mandate, using the mandate to reach broader digital engagement goals, maximizing consumer engagement, or you're not sure. So again, please take a moment to answer this question with one or a number of the choices that are available. And I think we have a good response at this point. So let's close the poll and share the responses. As you can see, 33%, 1/3 of you are working to meet the mandate. That's encouraging, though we wonder where the 67% are, and we find out that if that's the case, many of you are not sure where your organization is with respect to the mandate. These are interesting findings, and Keith, Matt, what are your thoughts on these?
Yeah, we asked this question, or a version of this question in almost every one of in every one of our discussions and presentations around mandates, and I think this is a bit of an outlier. So maybe during the Q&A we'll be able to hear a little bit more from participants in the call today. Normally we see working to meet the mandate to be kind of the number one, and then kind of using the mandate to reach broader digital engagement goals as sort of a distant second. And there's usually a small number of people who have the not sure loaded. This swing is pretty high here, but it is, I think it's representative of where we are. I think it might in fact be representative of the fact that, at least for the payer participants, now that we've kind of crested the first 7-1 deadline, everyone's sort of stepping back and taking a breath and saying, okay, what are we doing for 1/1/23? So there may be some ambiguity around that, but I'd be curious for the discussion to hear, hear how folks kind of sit in that ambiguity.
Yeah, we'll dig into that further. Why don't we go back to our presentation and allow you gentlemen to continue?
Thanks. Yeah, so I'll pick up and this, to some extent, this will be a little bit of a wrap up for what we're doing. And I think I started to talk about this a little bit at the beginning. I think some of this sort of came out, Denny, in your question around the role of transparency after the AEOB, which I think is, frankly, we've actually started hearing that question from some of our payers, right? Like, well, once we do the AEOB, do we need to have a shopping tool? Do we need to have a transparency experience? And again, I like to come back to something I say a lot, which is that transparency is a tool. It's not a goal, right? We all want, certainly transparency has value in and of itself. We consider transparency in a general sense to be a positive thing and opacity to be a bad thing, right? So like I think we all kind of intuitively understand that there's some inherent value in transparency. But within the healthcare context, I consider transparency a tool to serving something. And part of that, and frankly, most of that is around people, right? As I said at the beginning, for our health plan, for the people here who are representing health plans, these are your members, right? You serve your members. You kind of exist to help members be healthy and make the best use of their benefits to do that. For the providers represented here today, you provide care to folks, and we all want our providers to be practicing at the top of their license. We want people going into the right provider for the right problem to be the most efficient in delivering care and helping people stay and get healthy when they're not. And so, our view is the goal of optimizing that experience for somebody who needs care. There needs to be this framework of guidance, because again, for everyone here who's in the industry, there's a lot of information to know to make those decisions. And I'm sure every single person on this call has needed to go see a doctor, or needed to get a test, or needed to do that. And in spite of being fairly informed on how all this stuff works, it's still such a convoluted and difficult experience. Even if you know what you're looking for, I've needed care 3 or 4 times with my family over the last couple of years, and every single time, in spite of being very, very knowledgeable about how to find a provider, understand what it's going to cost and whether it's covered, I still struggle with it. And part of that is our system is very complicated. And so our view and our mission is really to think about that complexity and to think about creating this framework we call guidance on top of all of that complexity. And transparency is, like I said, a tool into making that more effective. And part of what's difficult in that space is the complexity of healthcare is part of the thing that's not understood, right? So when you talk to a person and you ask them about their healthcare experience, what you hear is a little bit of frustration, right? There's an expectation that I should be able to ask my doctor, what is it going to cost if I do this? Because when I go to a grocery store, I can ask the grocer what something is going to cost, and they know. So why wouldn't my doctor know, right? Or when I call my health plan and I say, is this benefit covered and what's it going to cost? The fact that the health plan has to explain that in context doesn't make sense to somebody, right? So when we do an annual survey of users, this is something we've been doing for years to understand sort of changing opinions and thoughts around transparency and benefits around healthcare. In our most recent readout, we're at a point right now where folks think comparing care should be like comparing other consumer purchases, right? 90% of people think finding ways to save on healthcare should be as easy as saving on groceries. What that means is that the idea that I want to understand what my options are and to know what cost and quality is, because not everyone buys a generic soda, right? Some people prefer Coke, some people prefer Pepsi, and they're willing to pay more for that, right? So wanting to know what the savings options are isn't the same as always buying the cheapest option. But the lack of information, the lack of ability to do that the tide has continued to, it's a slow tide, but it has continued to turn, and consumer expectations around this are really catching up with what we've all talked about over the last dozen years or so around the idea of consumerism in healthcare. And so when we present, when we think about this in the context of a real person making a real decision, and how do we help provide that? So we do, in the US, we do over 100,000 ACL reconstructions a year, right? That requires that a person identify a facility where they want to get that done, a surgeon that they're going to do that, what their recovery, what their physical therapy is going to be, what kind of lab work they need to do before that. All of those individual things have costs and associated. So this isn't just about throwing out numbers and prices for people. It's really about guiding folks. And so this is it's a visual we use a lot in presentations and talks. But what we think about, when we think about this, what we're really thinking about is sort of the aggregate experience of a person when they're getting care, right? So in the ACL repair example I just gave you, so there's a lot of things that you're going to need to know as a user that folks are looking for guidance. What is the problem that's facing here? What are my options from a treatment standpoint? What is it going to cost? How long does it take over time, right? So how long is the surgery? How long is the recovery period? Am I going to be able to go to work? When will I be able to go back to work? Or do I need to deal with childcare while I'm recovering? So all of these things are parts of the questions, not just what is it going to cost, right? But that is an important part of it. How much is it going to cost? Or that's a piece of the puzzle, right? But if you need an ACL repair, you're going to need MRIs before, you're going to need physical therapy afterwards, right? So having a view, a cohesive view of, to a person, what am I actually trying to solve for when I'm looking for a price quote or price estimate? And then of course we have the context of, as I said at the beginning, a regulatory framework that we have to exist within. And so our view of this, what does it mean to be done with health with transparency? It's really the idea that transparency becomes an integral, easy to access component of the overall question of when I need to engage with the US healthcare system, right? What does that mean for me? How do I make a decision as opposed to kind of become this passive vessel for decisions that are being made by providers in my health plan and hospital systems and all these other things? So it's really about how do we convert that experience for a user into something where they are understanding, they're getting assistance in making a decision, they're able to make a decision, and they feel good about what they've done through the end of that process. So that's just a very quick kind of overview of how we think about transparency fitting into the bigger sort of experience of a person engaging with a provider or a payer, in how that fits into that, what you need to be guided to be able to make those calls. So I think Keith and I are done talking. Now we want to discuss, right? So I guess let's jump into the polls, and Denny, I'll go ahead and let you engage with the crew here.
Always good to unmute my microphone. Thank you, Matt, and thank you, Keith. We're going to present another polling question here. Excuse me for a moment. My phone is ringing, and I needed to take a break for a moment to avoid being interrupted. But our poll question today is your organization currently using a tool that helps guide consumers to make decisions on their healthcare options. You could select one of the following: yes, no, or not sure. Again, our poll is your organization currently using a tool that will help consumers to make decisions on their healthcare options? Yes, no, not sure. All right, let's now, with just a minute of responses, why don't we take a look at what our poll has revealed? We have a considerable, if not unanimity and uncertainty, that our audience members are not sure as to what their organization is currently using as a tool to help consumers to make decisions on their healthcare options. Maybe I can turn this over, Matt and Keith, to you to provide your comments on this before we bring the poll down.
Yeah, so I mean, I think this is another one where I don't think I've ever been in a presentation where we had 100% answering at not sure, but this is one where not sure is always near the top. And I think kind of that therein lies the rub, I think, on some of this. About 2.5 years ago, as CMS was and the departments were kind of formulating the transparency and coverage rule, there was some discussion in both the House and Senate on legislating this around. I think some of those discussions came into the No Surprise Act. But in a previous organization that I was at, I actually went and did some background work with some congressional staffers. And what was one of the things that was really compelling was there was this desire to say payers are not putting price transparency out there on their own, and therefore we have to act. And part of what my pitch was, and part of my talk track was, almost every payer in the country had some form of transparency. At HealthSparq, we've got, like I said, we've got about 100 health plan brands. It's like 70 health plans or so. Almost every one of those has a transparency solution in place, right? The reality is transparency tools, these decision tools have been out there, but they're not highly utilized. And, I think that's one of the challenges, right? Is how do we help, we're trying to help users make these informed choices. We're working with our payers and our providers, customers to do that. But it's still reliant on a user engaging with that experience. And I think that lack of awareness is part of the challenge of transparency. Just one more quick anecdote. I was at a working group. It's kind of in that same time frame, actually. I was at a working group talking about data standards around transparency, and one of the participants in that group was a leader at a health plan. And one of their commentaries was, I don't understand why my plan doesn't do this. And it was a little embarrassing for me because they were a customer. So I actually pulled up their site and did a demo for them during the session of the way they were solving this. And I think there was a recognition that, hey, even within an organization, for folks who have some authority or control over this very problem, there's a lack of awareness. And so I'm never surprised when I see not sure as a leading vote here. And I think the lesson for me out of that is this is not just a technical problem to solve to get data out there for users to see. It's also sort of a traditional marketing member engagement problem of how do I help people know this information is there, help them use it when they need it, right? Because healthcare is an ad hoc need, right? You don't go and log into your health plan website once a month just to check stuff. You use your tool when you need it, and many times the use of those tools are being done by folks who are maybe scared or hurt or injured or sick, and so it's a difficult problem to solve, and it's frankly not a technical problem to solve, right?
So So now we're going to move back into our presentation, and thank you for that, Matt. I think you're right. I think the proof of the pudding is in the eating. We can build solutions, but until they become part of how people interact with the health system in advance of any kind of health care that they expect to be paying for or contributing to, we don't know how those price transparency solutions, we don't know necessarily what they are or how they're working. So I appreciate your insights on that. Just as a reminder to members of our audience, if you have questions, you can enter them directly into the questions panel on your screen, or you can raise your hand, and we will take your questions directly. We'll unmute you and allow you to ask your questions of our panelists. So let's go to one of the first questions that we have on here that I think is a particularly important one. You've touched on cost not always being the only factor. How do you bring quality or other factors into the price transparency data so that users, people, can inform their decisions with those data as well as with the pricing data?
Yeah, I mean, I think so. The way we approach that problem, or that opportunity, I guess, is to think about a holistic view of care delivery. And so we think about sort of this our idealized triangle is sort of cost, quality, and availability. But we really think about cost and quality in conjunction together. What we do know, especially on the payer side, is that the construction of a network is actually taking into account a lot of factors. So cost, network adequacy, quality, et cetera. And so our system is really set up to help a payer communicate, and this is on the HealthSparq side, is really set up to help a payer communicate their network in conjunction with sort of the way the payer thinks about quality as part of that network construction. So we show that information side by side. So when you're looking at a provider profile or a cost profile, or you're looking at a set of providers that do a thing, in our experience, what you're seeing is both the cost of care for that provider or that experience, as well as how the payer thinks about quality, whether they're pulling in quality measures from a third-party source, whether they've crafted their own. We've got payers that have worked with analysts to create a quality score, thinking about how their network relates to care delivery. We have a lot of flexibility in that, but our view is you show cost and quality together always, and so that people are looking at that people, when they're looking at in this experience and they're being guided to their options, they're able to see all of those things together. And we do see a place for both what I would consider to be like a quality metric as well as reviews. And there's a lot of there can always be a lot of consumer confusion about star ratings from a review standpoint versus a quality designation, but we kind of show all of that stuff together, and it's kind of it's sort of a bunch of components that you use, and when you put all those together, you get a nice picture.
Thank you for that. I appreciate that, Matt. Let's go to another question, which we have here around. You've talked about, setting up member self-service. We see self-service taking place in a lot of areas of the economy. In some cases, it feels like a burden. In some cases, it feels like a real benefit. But there are practices that make self-service work better than self-service efforts that don't include these practices. Could you talk a little bit about the leading practices or the best practices that you see, not just in healthcare, but in other industries, to activate a consumer's interest in self-service and to make it more of a tool that they will use on a regular basis?
Yeah, I mean, these are going to be very general, but I think they're good. I think they're good ways to think about how we talk about it and how we conceptualize that. So the first is what we as a we're a partner with our health plans, for example, but we sit in an overall experience, right? So The experience that we power for a health plan member sits within the context of an overarching experience that they have. There's other problems to solve when you go through the engagement. So first and foremost, for the way we conceptualize our experience, so we put user experience front and center, right? So our our normal product ideation cycle actually starts with user experience. So we run through problems to solve, we run through ideas on how to solve those. We look at corollaries in the industry, right? So, you know, in a normal UX design cycle, you're going to say, okay, what's the problem to solve? How are others solving it? What's working? What's not working? You run through user testing, you iterate quickly. So we do that. That's actually before we actually put fingers to keyboard to code. We're actually engaging with users in industry best practices around those sort of tasks to be done as a starting point. And that's pretty important. I think all of the talk of transparency and coverage is putting sort of the cart before the horse in terms of data. Keith owns our data, so I'm sure he you know, that's good for him. But the reality, I think, is we got to, if our goal is to help people make choices, we have to start with how can we do that, and then you bring the data in. And so that's the first thing that we do. I think the second thing we do is we work very closely with our payer partners around how does it all fit together, right? So our experience is white labeled. We're not pushing people to download a new web app just for our, or a new mobile app for our stuff. We sit within that payer experience. We kind of embrace the fact that, as I said earlier, there's no wrong door, right? Like how does a user who is engaging with healthcare, who's going to have a conceptualization of what they're doing. Some people think about, I need to find a doctor. Some people think about, I need to know what is care going to cost. Some people are saying, am I covered, right? There's a lot of different ways that a user is going to engage on solving that problem. And so what we work with our partners to do is to optimize their presentation of options within that overall member experience so that people who are engaging with that question can find their way in the right way. And then the third is that we think about the modality of those questions being asked independently of the tool, right? So some people do that through a call, some people do that through a chat, some people do that through digital experience, some people do that by asking their neighbors, right? So you can't ever really know how that conversation starts. So it's really important for the information that's needed to guide people to be available when and where that's being asked. And so we work with our payer partners to expose these experiences to their call center reps, to their chat operators. We work with chat, you know, AI chat partners to plug in our API so that they can answer questions more quickly, right? So there's a number of ways in which we're doing this and exposing the data and guidance framework that we have around care so that where those engagements are happening with members, that information is available as quickly and reasonably as possible for those things. Not every one of our payers does that well. We have areas, and there's, you know, I don't think we have anybody, for example, that's using IVL, right? We could do that in theory, where you could have that through a you know, a digital touchpad in your phone call, but we don't have anybody who's doing that now. We've talked about folks doing skills on Alexa, but again, we don't have anybody doing that today. But those are available, and I think that is our coaching and guidance. And the way we think about it from a technology standpoint is how can we meet the person who's trying to find care wherever they're starting that journey. And I think that's really the only way to do that.
Thank you. We have the no surprises good faith estimate and the advanced explanation of benefits, but we have a whole slew of services, many of which are going to be delivered as episodes, you know, are going to be delivered as a combination of procedure, anesthesia, facility, professionals, recovery, post-acute care, et cetera. How well are these going to work in advance of or before we start pulling those episodes together? It seems to me that one of the big customer engagement practices is going to be around who is first and best at providing the consumer a full picture of what they're going to be getting into when they thought initially they had to ask one question. They learned that there is, as you showed in a previous graphic, that there is more to that question than they might think. Can you talk a little bit about how the advanced EOB and the good faith estimates are going to work and how they will work better when we get a better sense of these kinds of episodes of care?
Yeah, absolutely. And I can take that. And I think that there's two different considerations. There's one for advanced DOB, and then there's one for the self-service tools. So with an advanced DOB, like once again, we don't have rulemaking, so this is a little bit of an assumption, but we are assuming that the provider who's submitting that advanced DOB to the payer to be priced, that they are likely to basically tell us that collection of services that they're going to be performing within that episode. And so whether it is purely within like the check-in to check-out of a surgery context or broader than that, and we're getting into pre and post-acute kind of care settings, will be determined based on how that legislation goes. But we do think that that is one where there's going to be more context within the actual submission of the advanced EOB about how to price it. The other piece of this is really on the self-service tool. On the self-service tool, I think the way transparency and coverage is defined is really about these single billing codes or single service items. And that is a major problem of, I think, the member isn't going to have the context to know this is not a complete estimate of what it's going to be. This is only a partial view. And so pushing to that, that either the episode or at least the check-in to check-out context of this is your all-in price for this is really a key element. And so there's going to be certain situations where that's kind of predefined by basically the contract. But in many cases, when we're doing just standard fee for service, that's not going to be the case. And so we feel like that is a critical element that kind of is important either to be going out with the self-service tool or going out as a fast follow, where you start to give people more of that all-in estimate, and then they can drill down into kind of the details of what goes in there. But I think it's going to be very important. One of the core components is there is not any kind of standards for what should be going into an episode. So everyone's kind of approaching it kind of on their own at the moment. There's different proprietary systems out there. And so I think it's an important element that we can kind of call out is, I think HealthSparq, we have our view, we know that others have their view. I think it's a good opportunity for us to kind of try to move towards more of a standard that can help set up in the future. We aren't kind of, if you look over here, you look over there, it's not an apples to oranges comparison. We're all using some sort of predefined methodology. So that's a longer term play. I don't think that that's going to happen by 1/1/23, but I think it's going to be an important consideration there.
Thank you, Keith. We have time for one more question. And again, I want to remind our audience members that you can ask a question directly by raising your hand in the attendee panel or by typing your question in directly. I have a question here that I'd like to put forward, which is, do you think CMS is going to advance data standards that are going to improve the adoption of everything from the machine readable files to the subsequent iterations that go into informing consumers about price and quality? Do you see CMS being more active in regards to what those data standards will be?
So we have seen CMS being very opinionated on the data standards within the machine readable file space for payers. Just a little bit of my own editorializing of what I think we've seen is I think they probably came in a little bit naive about kind of how these contracts were structured, how big this data was, and how complicated it was. And so they've done a lot of iterations there, but they've definitely kind of been very opinionated about this. I think what we need to see now is where they go next, because I think what they're kind of communicating is they want to get more and more towards like the specifics where they can reflect the contracts. I think that is going to be a big challenge, both from a we're seeing that kind of when you do it the way CMS has defined it is an absolutely massive amount of data. Is going to be hard for people to consume, to analyze, and to leverage. And so I think they seem to have indicated that they're going to continue to move down that path of pushing for more granular information that better reflects things. But I think is given the current structure of basically the healthcare system, how payers and how providers operate, without kind of a fundamental change and simplification there, I think they're going to have a very big challenge in actually kind of defining standards that appropriately reflect things. It just feels like there's kind of so much complexity in edge cases that they're going to have a difficult time in that until kind of there's other changes that go along with that. But from everything that we are hearing now, it does sound like they're at least going to try, and they're going to keep pushing in that. And so I think that's kind of our expectation there. And Matt, I don't know if you have any additional opinions that you want to add and kind of what you're hearing as well.
Yeah, I mean, I think there's two things that I'll be interested to see. So I know that with the AEOB work that's being done, you know, Da Vinci and HL7, like they're working on standards and FHIR standards for some of those transactions, which I think will help. I do think CMS seems to be pretty all in on FHIR, so I see them kind of continuing to push FHIR standards for things where you need to have this. What I think will be interesting, is after 1123, I would expect there probably won't be a lot of guidance before 1123 beyond what's in the rules now. But you know, things like Keith brought up earlier about how do you reconcile percent of charge versus an actual negotiated rate for a particular item or service. I don't think they've thought about those. I don't think they've thought through those items yet. And you know, the CMS was very active in modifying, answering questions, and evolving up until they locked the specs for the MRFs. And I don't see why they wouldn't do the same for the self-service experiences, but I suspect that's going to be after the 500 items and services. I think there's some room in the what do I do for the 500 shoppable services on 1123. They're fairly discrete. You can kind of do that. There's wiggle room on things like percent of service or percent of charge, like we talked about. But you know, fundamentally, it's a pretty defined scope of what you want to do. It's in the process of launching that and moving to those 500 services to the all items and services on 1124 that I expect that we'll see some clarification of rules. You know, again, the example I always like to ask for is, you know, there is a billing code for a recovery room, right? You don't shop for a recovery room. You get assigned a recovery room, and you're assigned a recovery room based on, you know, an intake availability. Like there's a whole bunch of factors that go into that. But the idea that I can go into a self-service tool and type in the CPT code for a private recovery room or the billing code for a shared recovery room and not have that related to the whole service offering, it doesn't make a lot of sense. That doesn't mean we shouldn't help people understand what the cost of those things are, but those costs have to be contextualized appropriately. And none of the rules today really think about that context. And you know, frankly, I know the intended list, there's other organizations that are trying to solve this problem here today. And I think we're all kind of trying to think about how do you contextualize this data in a way that's meaningful for end users. Again, transparency is a tool, it's not an objective. And I think for us, it's how do you use that tool appropriately.
Well, thank you very much, Matt and Keith. We have a number of folks who have stayed with us on the call. We've had a number of folks who have dropped off. We've covered the range of questions that we've received from folks online. I offer folks one opportunity more to raise your hand if you have a question to ask. Just to say first, Matt and Keith, thank you very much for your participation and your sharing your expertise with us today. I would also like to thank everyone in the audience who has set aside time in your busy day to join us. And we will, at this point, conclude today's presentation. Before you leave, though, it's important that we ask one thing of you, and that is you take a moment to give us your feedback by completing the survey that will appear on your screen when you leave the presentation. So thank you again. Please share with us your input, your feedback. It's quick, it's easy. We look forward to seeing you soon again, all of you, in a subsequent MHDC webinar or event. And with that, thank you very much, and we are adjourned.